Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, as we know, we were discussing about Rajayakshma, and we have seen Rajayakshma with a new dimension, how it can be compared with the immunocompromised state. So that part we have covered. So in this series, we have tried to explain the different types of Rajayakshma as mentioned in Samhita as the different causes of Rajayakshma. So we have got some calorie deficiency causes. We have got some Vegadharana causes, which are nothing but immunological causes. So we have got some emaciation causes, and we have got some dietary causes for immunocompromised state. So we compared Rajayakshma with the immunocompromised state. Anyway, now today we will come to the last part, that is dietary causes of immunocompromisation. When classics say that Vishamashanajanya Rajayakshma, it is nothing but irregular diet or improper diet or less amount of diet which is responsible for the immunocompromised state in a long term. Now there are various dietary causes which leads to immunocompromisation. Intake of the food by considering the quality, intake of the complete food, intake of incomplete food, and intake of abnormal and viruddhahara, intake of food in excess, maybe Vishamashana, Samashana, Vishamashana, Adhyashana, and also Anashana, etc. So these are some of the common causes which has to be considered under the heading of Vishamashanajanya Rajayakshma. Meanwhile, the Ahita Ahara, Asatmya Ahara, Apatya Ahara, and intake of the food without considering the digestive capacity also leads to abnormal digestion, assimilation, absorption, and also cellular metabolism. Now, disturbed metabolism due to malabsorption or maldigestion or malnutrition or structural, some of the deformities obstructing the absorption, some of the congenital abnormalities or anomalies which again interrupt with the absorption and this whole process of metabolism in the GIT may lead to increased catabolism and also decreased anabolism, resulting in excess production of the body waste products. Now, there will be excess amount of the body waste products when your metabolism is not proper. That means catabolism is more, anabolism is less. That leads to more amount of the bodily waste products, maybe at the GIT level or maybe at the cellular level. The cellular level, they are called as metabolic wastes. Now, this results in a scanty production of the dhatus. Now, what ultimately happens is when your ahara rasa is not get digested, ahara rasa is not get converted to rasa dhatu, and rasa dhatu is not converted into rakta dhatu. Now, ultimately, when the ahara rasa is not converted into the rasa dhatu, rather ahara rasa is get wasted up in purisha and mutra, etc. bhagas. Now, there is no formation of the rasa dhatu. Once there is no formation of the rasa dhatu, the subsequent dhatu production will be also get affected, and there is no production of shukra dhatu. And once there is no production of shukra dhatu, it leads to less amount of the ojas. And the same has been explained in the context of Vishamashanajanya Rajayakshma by Charaka, Bhavet Kinchit Ojase. There is very less amount of production of the ojas. That means whenever this metabolism is get affected, ultimately it is the body immune system which is get affected. For all practical purpose, we used to compare these ojas with the body immune system. Now, so what is immunocompromised state and Rajayakshma? Now we can come to a conclusion that a state which occurs after the repeated recurrent attacks of the infection due to various causes. Okay, it may be caloric deficiency, it may be immunological causes, it may be dietary causes, or it may be some of the degenerative causes. Or a state which act as a pool of different emerging disorders. Now, once you get into a state of immunocompromised state, then a person is prone to get any type of infection, because once your immunity is weak, so a simple respiratory tract infection can be also not managed by your body, and it also may be severe. A state which is difficult to treat as there are multiple causes, because usually in immunodeficiency conditions, the peculiarity of the immunodeficiency condition is there will be involvement of the multiple systems. Okay, if you look into the HIV virus, AIDS, one of the best example for immunocompromised state where you have multiple system of involvement. You have got diarrhea, skin infections, fevers coming, and the vomiting and other infections. Multiple systems are getting involved. Or even in case of combined immunodeficiency syndromes, B cell deficiency, T cell deficiency, or combined immunodeficiency syndrome. So there will be involvement of the multiple systems. Therefore, management will be little difficult. So what do you mean by immunocompromised state? A state which is quite dangerous, no doubt. Okay, because it can be a progressive fall in the health status will be there. Okay, a state which causes depletion in the body tissues or cell and as well as organs, a state which disturbs the functional capacity of the body with a definite psychological impact. Now, if you have seen in comorbidity, so we have got a disease called as Fakkaroga, and some of the symptoms which are explained here also matches with the Fakkaroga also. Okay, there also in the Vyadhi Fakka he says the same thing, Kinchit Bhavet Vajase, okay, Bhuktham Tesham Apartakam. So these words are also there, but it is explained by Kashyapa. That Fakkaroga is explained by Kashyapa. Fakkaroga is explained by Kashyapa, whereas this Rajayakshma is explained by Charaka. That's the difference. But I think there is some similarities also as far as this is concerned. Now, what is the immunocompromised state and Rajayakshma? So we have seen what do you mean by immunocompromised state. Almost a similar explanation is given in the classics regarding the Rajayakshma, which almost all satisfy the definition of immunocompromised state. Now, it is explained in relation to Rajayakshma that almost all the similar lines have been explained. Aneka roga anugatam. So there will be multiple disorders because immunocompromised state is a pool for different disorders. Any disease can occur. It's not only Rajayakshma is equal to tuberculosis. It may be one among them, but many disorders can occur. Then Bahu roga progamaha. So there will be multiple system involvement and multiple disorders. Durvijnayu. So very difficult to treat. So which system you want to treat? It's very difficult, isn't it? When multiple systems are getting involved. Then Durnirvano ho shoshoho vyadi mahabalaha. So there will be a marked emaciation, general debility, etc. And the vyadi bhala is more and deha bhala will be less in such condition. Deha bhala is nothing but immunological power. So that will be less and vyadi bhala will be more. And there will be a drying of the rasadi dhatus. Yes, metabolism is disturbed. So now, if you look into the definitions of immunocompromised state as explained in the contemporary science, it is almost all equal to this particular shloka which is given in the context of Rajayakshma. Therefore, we can better compare this Rajayakshma with an immunocompromised state rather than one particular disease. Now, let us look into some of the pathological consequences of immunocompromisation. So whenever there is immunocompromisation, what are the pathological consequences of immunocompromisation? So that we will cover in the next class. Thank you very much. Keep watching.